think that dogs, whether it be therapy, emotional support, or service dog, are great assets to troops coming home, getting out of the service, who suffer from this and trying to get back into a normal way of life. And I say that because my experience was I didn't understand what was going on. I didn't want to ask for help, so the only way I can relieve some of the symptoms for myself was to drink. And if I had a dog that I could take with me somewhere, another reason I drink, I'll explain, is because I mean a lot of different reasons, but to say in order to go to a restaurant or even Walmart during normal hours, not 2 in the morning, I was anxious, my heart was going crazy, I couldn't think properly. But if I had a drink or two, or maybe more, who knows, at the time, as my illness progressed, it became easier because it lowers your heart rate. It does just the opposite of what you needed. But if I had a dog, I wouldn't have had to have my illness progress, because I wouldn't have felt that I needed to drink to go out. I wouldn't have felt that I needed to drink to do certain things, because I had someone by my side, and like I did when I was over there in Iraq. That person always watching your back, able to watch your back while you're looking forward if you're in a store or they're doing different things. So I think it could help a lot of people not go down that same path.
So you think having a dog pretty quickly after discharge?
After diagnosis.
After diagnosis.
As long as it fits. Maybe after, say, I feel definitely not right after getting back, but right after you've been diagnosed, because there's a lot that you need to learn, and you're probably going to be impatient or through different treatments, and you have to wait till you're at least on your feet a little bit and have a good understanding of what's going on with you. And the canine therapy program that was here at Balboa Hospital in San Diego was great for me in teaching me whether or not a service dog would suit me, or if I would suit the dog. And I think something like that needs to be implemented across if someone's interested in going that route.
That was really good what you said, because there's so many people that rush into getting a service dog.
Yeah, I almost did it too, and
yeah.
If it wasn't for Marla, I would have.
And I think it's important that you said that, so that other people know not to rush into it, and to take care of themselves and get the other treatment before they consider getting a dog. Yeah. Because so many people are just rushing into getting a dog.
It's so desperate. People are so desperate to try to get to where they were before, or have some type of independent life or normalcy, and they jump into it, not realizing everything that goes into it. And I think that's where a lot of problems come from. At least that's what I've learned through my journey. Mm-hmm. The reason I've been so patient into getting a service dog is not because I don't want one. It's because I almost jumped into getting one, and it would have been a very bad experience for my family and I, because the dog wasn't trained. There's a lot of people jumping on the bandwagon saying that they're trainers, and they're not. And I learned that by almost getting this dog and being talked into going into the canine therapy program, which is 6 weeks, and being taught exactly what I need to do for the process. And because I love dogs and animals in general so much, I want to make sure that everything is set right, so the dog's not coming to me and we're not ready, I'm not ready, and it'll only hinder the dog. The dog's here to work, and that's important, because it's not just a regular pet. This is a working dog that's been trained for most times 2 years to be where they can go out and take care of you. So you want to make sure you take care of the dog.